Chapter 28 Oncology. Exercise 28.1. Complete the table with words for A, B, and C opposite and related forms. Verb, noun, adjective. Cure, cure, curative. Exercise, exercition. Ground, ground, growing. Invade, invasion, invasive. Obstruct, obstruction, obstructive. Palliate, palliation, palliative. Palpate, palpation, palpable. Spread, spread, spreading. Swell, swelling, swelling, swollen. Exercise 28.2. The nouns below are about the patient described in the opposite. Use them to put the sentences 1, 9 in the correct order. They make the next paragraph of the case report. Use Appendix 2 on page 20 if you need help with the abbreviations. And number 1 is number 8. His pulse rate was 100-minute regular and blood pressure 112/66. Number 2 is number 4. His cardiovascular and respiratory systems were normal. Number 3 is number 2. His mouth and throat were normal. Number 4 is number 6. On examination, his temperature was 37.8 degrees Celsius. Number 5 is number 7. There were a large lymph nodes in both axillae and inguinal areas. Number 6 is number 1. Examination of the central nervous system was normal. Number 7 is number 3. There was a smooth, firm 3 by 4 centimeters mass in the right supraclavicular fossa. Number 8 is number 5. On abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. Exercise 28.3. Complete the sentences. Look at A, B, and C opposite to help you. Distant sprint of tumor cells is known as metastasis. Number 2. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. Number 3. The opposite of painful is painless. Number 4. A malignant neoplasm is called a cancer. Number 5. Tumors which do not invade or metastasize are benign. Tumors which do not invade or metastasize are benign. Number 6. Secondary tumors are those which result from the spread of a primary. Number 7 is a cure is not possible. Palliative treatment should be given. Number 8. A palpable liver suggests metastasis. Chapter 29 Pregnancy and Childbirth. Exercise 29.1. Complete the sentences. Look at A, B, and C opposite to help you. Number 1. A baby that is born a week before the EDD is premature. Number two, a termination of pregnancy may be necessary for medical reasons. Number three, the first 3 months of pregnancy are known as the first trimester. Number four, fetal distress in the first stage of labor is an indication for cesarean section. Number five, it was a breech presentation and delivery was before forceps. Number six, a miscarriage is another term for a spontaneous abortion. Number seven, the umbilical cord was wound tightly around the baby's neck and it was unfortunately stillbirth. Exercise 29.2, complete a table with words from A opposite. Verb noun. Abort version. Deliver delivery. Induce induction. Miscarry miscarriage. Present presentation. Terminate termination. Exercise 29.3, Dr. Bennett and SHO is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of verbs from 29.2 above. This is Carla Davies. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was um, 18, which was terminated, and another one a year later, which spontaneously aborted. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section. Chapter 30, the respiratory system, exercise 30.1, make word combinations using a word from Xbox. Look at A and B opposite to help you. Blood stained, breath sounds, pleural rub, productive cough, vocal resonance. Exercise 30.2, rewrite the questions using words that are better known to patients. Look at A opposite to help you. Number one, is your cough productive? Do you cough up any phlegm? Number two, what color is the sputum? What color is the sputum? What color is the phlegm? Number three, is it ever purulent? Is it ever yellow? Number four, have you ever had hemoptysis? Have you noted any blood in it? Number five, do you suffer from dyspnea? Any problems with your breathing? Exercise 30.3, are the following statements true or false? Give your reasons for your answer using your medical knowledge, and A and B opposite to help you. Number one, a patient who has a loose cough produces phlegm. True. Number two, crackles are here when the airways are narrowed. False. Number three, a patient who has a not productive enough produce sputum. false. Number 4, whistles are typical of pleuris, pleuris, false. Number 5, pleural roof is a sign of asthma, false. Chapter 31, the scheme 1, exercise 31.1, complete the description of hyper-zoster shingles by replacing the medical words in brackets with ordinary English words. Look at A and B opposite to help you. Number 1, shingles, hyper-zoster, usually start with pain or soreness. Then red spots, macules appear that develop into groups of small blisters, vesicles, over a particular area on, on one side of the body. In most patients, new spots or blisters lesion continue to appear from 3 to 5 days. The vesicles become uh, filled with pus, muscular, and then from scab crushed. In severe cases, there may be scars, cicatrices afterward. Exercise 31.2, read the description of the rash of rubella and complete the notes. Look at A and B opposite to help you. The spots are scattered pink macules which appear first behind the ears and on the forehead. The rash spread rapidly first to the trunk and then to the limbs. Location and distribution. First behind the ears and on the forehead, then the trunk and limbs. Grouping. Scattered. Type of lesion. Macules. Color. Pink. Exercise 31.3, complete the notes for the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Will spread on the chest and abdomen. Grouping, scarlet, type of lesion, some scales, small macules with, type of lesion, small macules with some scales. Color, pink. Exercise 31.4, complete the notes from the lesion in the photograph and suggest and diagnosis. Look at A and B opposite to help you. Location and distribution. Below lateral ankle of the left eye. Grouping, single, type lesion, nodule, color, white, pink.